Hi, my name is Arlen Sean Tuller, and I'll be talking about prostate cancer, the facts, risks, and prevention. Prostate cancer is somewhat unusual when compared to other cancers, as many prostate tumors do not spread quickly to other parts of the body, and many men can live with prostate cancer even without knowing they have it. Um, The age is a factor. It's rare in those under 40, but odds rapidly rise above 50. Roughly 6 to 10 prostate cancer cases are in those older 65. African American men, of course, and Caribbean men with African heritage develop this younger and more frequently. It occurs less often in Asian American and Latino men than in non-whites, and the reason is unclear. And as far as geography, more prevalent in Australia, and of course the Caribbean, Northwestern Europe, and North America have the highest rates. With the family history, does run in the family, which suggests there may be some inherited factor. Still, most prostate cancers are in men without a family history, but your risk more than doubles when you have a brother or father with prostate cancer, and your risk is much higher if you have several relatives with this kind of cancer. Also, gene changes or mutations raise the risk of this kind of cancer, such as if you have the BRCA1 or BRCA2, which is those found in creating breast cancer. Several factors in diets have been studied. Dairy products may slightly increase your chance, excessive amount of calcium, and then some environmental stuff, like there's some evidence firefighters being exposed to chemicals increase their risks of prostate cancer, and possible link between Agent Orange and prostate cancer. Also, inflammation of the prostate may be a link to increased risk, and if you've had a vasectomy, you may have a slight increased risk. There's no sure way to prevent, but there are some good ways to increase your odds. Be healthy at a healthy weight, keep physically active, and don't eat a lot of calcium. There are some ways you can be tested for your PSA, your prostate specific antigen, and also by a digital rectal exam, check for enlargement. And if those things are indicators, then you would get a biopsy. Some signs and symptoms. Problems urinating is probably the biggest. Weak stream, slow stream, blood in urine. If you cannot get an erection, and then also if you have advanced like pain where bones are, like hip, back, chest, those areas, that would mean that it's already spread. And also if weakness and numbness in legs and loss of bowel functions, just for the fact that things are pressing along the spine. So basically, the American Cancer Society counsels men to be educated about the risk of the screenings and possible benefits of the screening. And then definitely if men over 50, if they're average risk, men at 45, if they're a higher risk, including African American men, and then men at 40, if they're at the highest risk where they have more than one male who already has it. There's a lot of questions to ask as far as, should I have active surveillance? What kind of treatment do you recommend? What kind of procedure should I get? So that just make sure you're looking at the right kind of treatments and see if there are any clinical trials. And you just want to ask some really good questions about, side effects, kind of problems that could arise, what I could do about those problems that can come back to you. So, and then during treatment, what side effects to look for, those kind of things, and what should I eat? And then, make sure you're asking good questions about after kind of follow-up and diet care. And here are my references. Thank you.